Greetings. Welcome to This is Public Health with the Tuscarawas County Health Department. My name is Jennifer Demuth, and with me today I have Michelle Genetin and Katie Seward. Now at the Tuscarawas County Health Department, Katie Seward is our Health Commissioner, and Michelle Genetin is an SIT and an environmental specialist, and both have master degrees in public health. So as we talk today, they are really going to give us a lot of information that's going to help you and explain how we work all the time to help Tuscarawas County residents. And first of all, I just want to say, has anyone out there ever wondered, what is public health? I mean, sure, you probably think of things a lot of people think of, such as, the health department is the place that houses WIC services for families. You might think of how, we do immunizations for babies and for children about to go back to school. Those are things, a lot of people tend to think of. You may even think, oh, that's the place we go to get a copy of our birth certificate. But the public health department really is so much more than those things. And we're going to share with you a lot of information that will help you understand, all the things that your public health department does to help you as a resident of Tuscarawas County. And you might learn some things you didn't know before. So without further ado, we'll go ahead and get started. So we'll start with Katie. You are, of course, our health commissioner, but even before being a health commissioner, I know you worked as a certified health education specialist, also as a certified tobacco specialist, in tobacco prevention and treatment, so you have a wide breadth of knowledge. So, if you had to sum up, what is public health for the person out there listening, how would you describe it?
Sure. So, I learned about public health myself when I was taking an undergraduate wellness class at college. And what I really found fascinating about it is it really kind of put the power back into individuals' hands. So what I mean by that is public health often looks at programs and strategies and policies that can impact a large amount of people rather than on an individual level. So certainly it affects you positively as an individual, but it makes a larger impact to the community. So what I mean by that is when we look at individual health, oftentimes it's about going to a medical appointment because you're sick or you have a chronic disease that you need treatment for, where public health takes more of a prevention route and looks at ways that we can stop unnecessary doctor's visits or put programs into place that can make people generally healthier or live in a safer environment. And so for me, it just seemed like a field that I could really have an impact on. And, learning more about the Tuscarawas County Health Department prior to coming here, one of the things that really drew me is the fact that we have so many supplemental programs that are not mandated by the state. And we really go above and beyond to try to bring programs to the community to fill any gaps that might be there. Mm-hmm.
So I know, prior to the start of COVID-19 at our health department, you had purchased some stickers for us that said, "This is public health." And we had started this idea that, we were going to put these out in the community so people understood, what public health was. And so, what are some of those things that public health does behind the scenes, that people don't usually think of? Maybe you can list a couple, maybe Michelle, you can list a couple, maybe out there you can all think of a few things. So, go ahead, let's have a conversation. Let's name a few things that are public health.
Sure. I'll let you take from the environmental side, because I think there's so many things that impact us on a daily basis from even like the restaurant side that people may not even know that we do behind the scenes.
Yes, that's exactly what I was thinking of. Environmental health, our division there is certainly one that many people may not realize all that we do. Like Katie mentioned, a lot of people are familiar that we may go out, and we do go out and do food inspections. We license food facilities, whether it's food service operations or retail food establishments. We also license temporary food events. So if there are fairs and festivals that offer foods, or oftentimes you might see mobile food trucks, we license those as well. And the point of that is really to make sure, again, the mission of public health is to protect and to prevent foodborne illnesses. And a lot of times that can happen by improper cooking temperatures, improper holding temperatures of food, making sure the foods are coming from approved sources, and also making sure we are encouraging and educating on personal hygiene, such as properly washing your hands and making sure that if you're sick, you stay home. A lot of things that we do know. But that is a lot of times something that goes on behind the scenes. So when most people go out and want to enjoy a nice evening at a restaurant, we are doing our due diligence to make sure you are able to do so safely and enjoy yourselves. But that's one of just the main programs we do in environmental health. We have quite a few. Another one I think a lot of people may be familiar with is our septic and water quality program.
Michelle, that's great information about, the food licensing. So really, if we were going to put up a sticker that said this is public health, we could almost put one on every restaurant around, it sounds like. And when it comes to that, if someone has a concern about a local restaurant, what would they do? How would they maybe let the Tuscarawas County Health Department know about that?
Yeah, that's a great question. So if there is a concern, if somebody has something they want to bring to our attention, they can reach out to us and we can follow up on that and make sure that we are educating the operator on how they can take those steps to fixing or resolving that issue.
Okay, so really, because there's a lot of great restaurant owners in our community, and we certainly support local business. So basically, if someone has a concern, our environmental health specialists like yourself, you're going to go out and you're going to go with that education perspective of, hey, we received this concern. How can we help you understand, or how can we help you, maybe improve a process here if there's something that needs improved. So it's kind of like holding their hand and helping them through that process.
Absolutely. We definitely want to encourage our operators to make those steps on their own. And we do take that educational approach so that they can proactively prevent something like that from happening. And a lot of times our operators are relatively grateful for bringing that to their attention, because as they also want to serve the public. So we like to be a middleman, kind of a resource for both parties, so we can help make sure that they are able to do what they need to do while protecting the public as well.
So, Michelle, it's probably not uncommon for someone who wants to start a business or even start like a food truck operation to reach out to the health department to say, what do I need to do to safely do this?
Yes, absolutely. It's not uncommon at all. And I think a lot of times people get excited. They think of food as a great way. And there's a lot of people out there that have a lot of great ideas and very creative. And we just encourage people to reach out to us first before making any plans, because there are quite a few steps that need to be taken before doing that. And we are certainly happy to help them in that process.
Wonderful. So we can help local restaurant owners, and we can help those of us who eat in the restaurants just to make sure we have the best food possible. And we do like food. So
yes,
this is very good. All right. Excellent. And so, at the Tuscarawas County Public Health Department, I know that, our vision is sustainable environment. So we definitely talked a little bit about how we do that with restaurants, healthier families and thriving communities. And then we think about sustainable environment, again, Michelle, I think of, water fountains in parks. Those could almost have a sign that says this is public health. What makes that public health?
So oftentimes that's a great thing, kind of tying back into what we do behind the scenes. For instance, if you see a drinking fountain out in maybe a public park, that is typically maybe public water that a municipality would provide. Whereas for us, we would handle the private water systems. And that usually is a well, a cistern, a pond, something that comes out where a public service isn't provided. And with that, what we do is we first go out, evaluate a site to make sure that it can support a system. And once those meet that criteria, to make sure there's proper isolation distances that can't contaminate the water, then we have a permit issued to an installer to then go out. Following that, we inspect it to make sure that all of it was done by the state standards, and then we take a test to make sure that the water is safe to drink. And that's ultimately what that is about.
So basically at the Tuscarawas County Health Department, we're trying to make sure the water you get is safe to drink.
Absolutely.
And we're protecting the water sources, right?
Absolutely.
Even to the point, do we go out and look at, landfills to make sure everything's going well there and operating smoothly so that the landfill isn't, impacting our water quality in a bad way? Are we doing things like that as well?
Yeah, we also have a solid waste program that we do go out and inspect. Our landfills here around Tuscarawas County, most people are familiar with Kimball as an example. And so we do go out and monitor how we properly collect and transport, as well as dispose of trash and solid waste. That can be something that can contaminate our drinking water, because it first starts by potentially seeping out into groundwater that can then reach our drinking water. And we want to make sure that we are, overseeing things like that can become a contaminant for drinking water. And ultimately, those things pan out into our water quality program so we can make sure that it is safe and suitable to drink.
Wow. So there's really a lot of science and a lot of steps that go behind making sure our drinking water is safe.
Yes.
Yeah.
And that's just a snippet.
Right.
It's very complex.
Thank you for giving us the Cliff Notes version. I imagine it's a very large volume of information, but that's excellent. So, we're really working hard, to make sure we've got that sustainable, healthy environment here so that families can thrive. And Katie, when it comes to creating healthier families, what are some examples of the public health programs we do at the Tuscarawas County Health Department that help families?
Sure. And, just to, go back to what Michelle was saying, the thing that strikes me about public health is that when we do our job well, we get to stay under the radar, because it's all about prevention. Mm-hmm. So we can do these things behind the scenes so that people can go out to restaurants, so that you can get water, from your faucet at home and drink it and not have to think about whether it's safe or not. So we do these things, we do them right, and you don't have to think about it. So that's kind of the cool piece about public health. But in terms of healthy families, we do have a wide variety of programs. We have a rural health center, a medical clinic. So anyone can come if they have acute problems such as a sore throat, a cold, they need to see a provider. And also if you have chronic health problems, hypertension, high blood pressure, diabetes, things like that. We have well checks for children and sports physicals and immunizations, as you has mentioned earlier. And then we also have our WIC program, Women, Infant, and Children Supplemental Nutrition Program, which is a federal program that provides supplemental nutrition vouchers for pregnant women and young children and moms. And then we also have some newer programs that we have in place that, again, we've kind of looked at the community and said, what do we need? Where do we need to fill these gaps? And we've applied for grant funding to be able to implement these programs. And we have one such program that provides safety and home equipment for young children and babies, so pack and plays, car seats, smoke detectors, carbon monoxide detectors, things of that nature to keep families healthy and safe at home. We do car seat checks, so if you have a new one that you're expecting and you're not sure, it's complicated. It's complicated to install a car seat, and you look at the book and there's diagrams and you're like, which strap goes where? Yeah. And everyone's a little bit different. Every vehicle's a little different. And one of the things that we do track is when we go out and do car seat checks, the misuse rate. Mm-hmm. And I'm always so shocked by the percentages that we're getting back. 75% or more of car seats are misused and people don't even know that they've been installed incorrectly. Mm-hmm. So that's a free program that we provide to the public.
Yeah. Can I share a little story about that?
Yes, please.
All right. So before I worked at the health department, I was getting ready to have my first child, and my husband and I are kind of nerds, right? So we read all the manuals and we did the class on car seats. I mean, we had everything right. We were sure we had everything right. We had the car seat base installed and, checked everything. Yep, we got it. We had the manual taped to the bottom. I mean, it was all where it was supposed to be, at least what they were teaching at the time. And we got in the car to bring our son home, and in the car seat, he was leaning like forward a little bit, like his neck. And I'm like, oh my gosh. And I said to my husband, we are not going home. We are driving right up there to the Tuscarawas County Health Department. And I'm going to pray somebody's there who can help us because I don't know what we did wrong, So we pull up to the health department. Thank goodness 2 of your health educators were in at the time. They came right out. Of course, they were all excited to meet the baby, and they're always like cute babies, right? And everybody's got a cute baby, and they came out, oh, Jennifer, don't worry, you did everything right. It's the way the back seat was designed. It leaned. And so they had a little thing they had to do to adjust it so it would be more level, so they adjusted it and then we could drive home, not walk home. We were going to walk home if you guys weren't there. We were able to drive home safely, and I was just so thankful for that program, just that anyone can go and see, is my car seat installed correctly. But I know also folks that maybe can't afford a car seat or a booster, that we can provide help for that too, which is amazing.
Absolutely. And those are just some of the programs that we have available. We do have programs that we're adding all the time and that we identify as, we need to, help the community in this capacity. And so we're always looking for funding opportunities to bring those needed programs. Another program that we have that you may or may not know about is our traffic safety program. It's called Safe Communities. And it is a great program that has established a coalition that really takes a look at our roadways and our traffic statistics and unfortunately our fatalities and ways that we can prevent traffic fatalities from occurring in Tuscarawas County. And we have a lot of rural back roads as well as major intersections. Yes. We have motorcycle accidents, unfortunately. So those campaigns out there that you see, click it or ticket, drive sober, get pulled over, watch out for motorcycles, those are all things that are promoted by our Safe Communities program. And so it's just, we do everything from food inspections to well inspections to car seats and traffic safety. And it's such a great place to work because you always have something new that you can be learning because we're so diverse in the programs that we offer.
Yeah. So really, when we go back to that question of what is public health, how do you even begin to define it? Because it's so much. It's so much. It's anything and everything we can do to make sure that we are, really following our vision to have that sustainable environment, create healthy families, and have our thriving community. Katie, you were talking about prevention, and that reminded me of our grant-funded programs for tobacco cessation and prevention, and, for Narcan, Project Dawn as well. And I know, like with tobacco, we're always trying to get that information out there. There are free programs in Ohio that will help people quit.
Absolutely, yeah. So we promote the Ohio Quit Line, and if you call them, they actually can provide you nicotine replacement therapy at no cost, which would include things like your patches, your gums, and your lozenges. So if someone is interested in quitting, we can certainly link them to the resources that they need at no cost to them to be able to take that first step. Mm-hmm. And then on the other side of it, on the prevention side of it, we really work to partner with youth in our schools and ways that we can prevent things like e-cigarette smoking and use of flavored tobacco, which is pretty popular among our younger students and children. And then also taking a look and working with our tobacco retailers to make sure that they're following the laws, such as not selling to individuals under the age of 21, and ways that they can make sure that they're not necessarily marketing to our youth by promoting flavored things or things next to candy aisles and things of that nature.
And I imagine, just like when we license food operations, this is similar with tobacco retailers. If they are perhaps placing a product in a place that's not the best and is, not a good placement for youth, we're going to go in with an educational approach of just, hey, correct, how can we help you? Like, this is something the state of Ohio doesn't like to see. Maybe put it here instead, and we can help you.
Right. So we don't license tobacco retailers, and so when we do go in, it's definitely from an educational and partnership type relationship. Mm-hmm. We want to have open dialogue with the sales people as well as the owners of the stores, and what are some of the things that you're seeing? Are people bringing in fake IDs, or are they having people buy for them when they're actually too young to purchase? And then just ways that we can help them to make sure that they don't get cited by law enforcement for selling to a minor. Mm-hmm. And so we're there as a resource to help these tobacco retailers as much as possible.
Mm-hmm. Yeah, to help with the prevention of youth.
Exactly.
Yeah, that's good. Not the prevention of youth, but tobacco use.
There you go.
Yes, there we go. We talked so much. One common theme is help. Right? I think sometimes people out there think, oh, you're there to tell us what we're doing wrong. But what I'm hearing is we're here to help. Yes, we're going to say, hey, maybe you can improve in this area, but we're here to provide those resources to really help people, whether it's a business owner, an organization, a family, really, anyone in Tuscarawas County, we're there to help. If it's questions about, illnesses, questions about, we've talked in a previous show about our mosquito control program, and you're worried about that. We're helpers, right? Mm-hmm. So,
yeah, and one of the things that the health department really tries to make an effort to do is to be present on many of the coalitions and associations and groups that are present throughout Tuscarawas County. And so what I always tell people is if you're not sure where to go for some type of information or help that you need, call us. If we can't do it, we're certainly going to at least link you to someone that can. And I think Tuscarawas County is really unique and blessed in that we do have so many agencies and organizations that provide so many great services.
Yes.
And if we can just be someone that links you to those, then we've done our job as well.
Exactly. Yeah. We're just really there to help. And, I think when we look at, in particular, an area we've been helping a lot in is the COVID-19 response activities. And, we're going to continue to be there for individuals and organizations and schools and families, to help with information on that. And we just like to share that information so everyone can make choices, and that's what it's about. Whether we're sharing facts about COVID-19 cases or as flu season starts to get going, if we're sharing facts about flu cases, we're just sharing those things so everyone can make, healthy choices about what's right for them and their family and their organization. And when we look at, some of that, I know COVID-19 is not, the only communicable disease that we track and assist county residents with. So what are some of the other communicable diseases, that we keep track of and try to help patients or families struggling with those? What do we do?
So one of the ones that is always pretty prevalent in the summer is Lyme disease. And we've certainly seen in recent years the case numbers increase with that. I think it is a disease that is often underreported simply because when you go into a provider's office and you have those symptoms of Lyme disease, you've gotten bit by a tick, you have that hallmark bullseye rash, the doctors know it's going to be Lyme disease. Let's go ahead and put you on an antibiotic, which is typically doxycycline, and it's a pretty benign antibiotic, and let's get it taken care of. They don't necessarily always need to send out that diagnostic blood work to confirm that it is indeed Lyme disease. So unless that blood work is done, we don't necessarily count it as a case because it's never reported to us. So the cases that we do know about, we are already high. And then we know that there are many others that aren't reported to us. So Lyme disease is one of them. We talk a lot about to individuals who, aren't sure what's normal. Hey, I got diagnosed with Lyme disease and I'm taking this antibiotic. Is it normal that I continue to have, these aches for weeks after? And just trying to answer questions and concerns that they may have. We do sexually transmitted diseases. So we not only screen for those, but we can also provide treatment right at the health department, completely confidential services. And so we're there if you ever have concerns about that. And then other things like foodborne illnesses and meningitis and things that tuberculosis, things that can be passed from person to person. And so the goal of getting information on those things is that we can, one, determine if there is an outbreak, so meaning that there's more than one case in a given location, and two, controlling the spread. So talking to those individuals, letting them know what they can do to protect the people in their household from getting it, from people in the community, and then also how they can get treatment to become well again.
Wow. So we're also helping people to not get sick. That's always good.
Ideally, yes.
Then they can go out and enjoy the restaurants and drink the healthy water at the park.
There you go.
And call the 1-800-QUIT-NOW line for tobacco and just keep getting healthy because of everything we're working to do here. So, I would say with our friendly staff and, so many great professionals that we are blessed to work with at the health department, it'd be safe to say really we could almost all have a sign saying, I am public health, and we are public health. Because we really do care about the community. And so I know we're running out of time, but briefly tell me what it is you love about working at the Tuscarawas County Health Department, Michelle.
Well, as far as my journey in public health, I kind of stumbled across public health as far as my education and getting here. But I did work at another health department and got my feet wet in public health. And I do like the rural side of public health. It's what I grew up in. So I feel I can use that as a way to relate to a lot of people in our community. And that is something I really do like about public health. And much like Katie mentioned, as far as a preventive measure and how we can empower people. Excuse me. I do really enjoy educating people and using that as a bridge effort, especially on the environmental health side of things. I know a lot of times people think and look at us as the enforcement side, which we do have to do that in a lot of ways as part of the Ohio Revised Code and things of that nature. But I think a lot of times people forget that we are a resource to help educate them. And I really enjoy that. And I really like to relate it in a way that makes sense to people, much like, oh, yes, you need to have a septic system. But hey, maybe if you run water at different times during the day, that will help with the longevity of your septic system. So it'll last longer. Therefore, you won't have to replace it maybe as soon. Mm-hmm. So it's things like that that I like to think of that I can relate to a homeowner, or if I go to a restaurant, why this might be a better measure as far as doing this instead of doing that, that they might maybe understand, and then they feel empowered to do it on their own. I really enjoy that aspect.
Oh, that's really great, Michelle. And Katie, what do you love most about working in public health?
So interestingly, we do a workforce development survey on an annual basis. And one of the questions that I always ask our staff is, what do you like working at? Why do you like working at the health department? And the number one response that we get is because I enjoy helping people, and really coming in every day and hoping that you can have an impact, a positive impact on at least one person, and if our 50 employees each have a positive impact on one person every day, that's 50 people in our community that has received, good service and been empowered potentially to do something to make their lives healthier or safer, and that just trickles down. And so for me, again, it's about, helping people as well as, learning something new every day. With public health, it's always evolving. We have emerging communicable diseases. We have changes in technology and programs and strategies. And so it's just a field where I feel like I am blessed to be a lifelong learner. And every day I feel like I pick up something new that I can then hopefully pass on to the public.
Yeah, I would agree with that. We definitely learn something new every day. It is not boring work at all. And it is so fulfilling, even I know for me personally, I'm going to say the same thing. Just knowing when you go home at the end of the day, we've helped someone, you just can't put a value on that. That's a priceless feeling. And so, all right. Well, we've kind of run out of time. Thank you, Michelle. Thank you, Katie, so much for your time today and for sharing more information about this is public health and really what is public health in our community. And so, listeners, if you're ever out there and someone asks you the question, what is public health? If you listen today, I bet you can give them a really great answer. Thank you so much from all of us at the Tuscarawas County Health Department. Have a great day.